Our next paper is Subspace Learning Model for COVID-19 Ultrasound Image Monitoring. Dennis Ho has a wide research interest from the representation theory of vertex operator algebras to modular tensor categories in conformal field theory. He is a co-author for Rapid Community-Driven Development of a COVID-19 Tissue Simulator published on Biox of April issue. He is responsible for software development of today's paper. Dr. Raymond Ho is an emergency medicine physician in Long Island Jewish Medical Center. During the New York pandemic, he dedicated his service to intensive care units for patients with COVID-19. His recent research work on COVID-19 complications has been published in Journal of Gastrointestinal and Hepatic Surgery, August issue. He is the COVID-19 medical advisor for the current paper. Jan Pyo-ho is an optical engineer by training. His current research interest is healthcare and wearable technology devices for the elderly to continue the life and routing they are used to. He is responsible for hardware implementation of the current paper. Today's presenters are Raymond Ho and Jan Pyo-ho.
Timely and accurate diagnosis and prognostication is a key factor influencing patient care. This is particularly relevant in resource-limited settings. The UK Intensive Care Society outlined an algorithm for COVID-19 in both nursing home and hospital settings. In addition to a clinical assessment for symptoms such as fever, cough, or shortness of breath, a portable ultrasound could evaluate for various findings that identified patients who would benefit from hospital evaluation. One caveat regarding ultrasound findings: they are not specific. B-lines and pleural effusions can show up in a variety of diseases, including congestive heart failure, pulmonary edema, fibrosis, atelectasis, pulmonary contusion, and a host of viral pneumonias, including influenza, RSV, adenovirus, rhinovirus, and parainfluenza. That being said, this slide lists some normal and abnormal findings associated with COVID. A-lines are horizontal air artifacts of normal lung parenchyma. B-lines are vertical comet tail artifact lines that move with lung sliding. More than 3 B-lines in one intercostal field represent subpleural interstitial fluid. Lung consolidation may occur when inflammatory and purulent fluid fills the alveoli and the lung appears solid with a homogeneous, relatively fine echotexture. Different consolidations may correlate with a bacterial versus viral pneumonia. On average, COVID patients seem to deteriorate within the first 8 to 9 days and will recover after approximately 14 to 16 days.
After software and hardware implementation, a portable ultrasound image can be fed into our device for classification. The user can tell if the image is an A-line pattern, B-line pattern, or consolidation pattern with over 95% accuracy. So the stage of COVID-19 progression or recovery can be identified by nursing staff without the need of an ultrasound specialist. This is particularly helpful in resources-limited senior communities, such as assisted living or nursing home.
Portable ultrasound has some interesting applications in pre-hospital medicine, which involves EMTs and paramedics who care for patients en route to the hospital. These include fast exams, which detect blood or fluid in the abdomen, determining cardiac activity, and differentiating asystole and pulseless electrical activity from pulseless VTAC or ventricular fibrillation, ultrasound-guided venous access, or confirmation of endotracheal tube placement. These are all things that are possible with portable ultrasound. Both Europe and Taiwan have conducted studies regarding pre-hospital ultrasound and found that they did indeed change emergency management. They also concluded that training requirements and time limitations were the biggest constraints. more data is needed in regards to whether or not pre-hospital ultrasound can actually affect and improve patient outcomes. In addition, 2 studies in Rome and Tel Aviv showed how ultrasound findings could help with risk stratification and prediction of mortality, ICU admission, and mechanical ventilation needs. Ultrasound scores were assigned to each patient. These were a composite of pleural thickening, prevalence, subpleural consolidations, etc. Routine use of lung ultrasound may guide patient management, as well as resource allocation during cases of surge capacity. Extrapolating from this, more research could be done to see whether or not mortality and ICU admission can be predicted in nursing homes or with EMS.
We are very happy to announce that your presentation has been chosen as the Best Presentation Award. In this regard, we would like to invite you to join the valedictory session on October 31st.